guys, welcome. Today we are going to discuss about the multiple sclerosis. We will discuss the introduction of multiple sclerosis. Multiple sclerosis is the demyelinating disease of central nervous system, brain and the spinal cord. What is myelin? Myelin is a protective sheet around the axon which allows the electrical impulse to move quickly. How this myelin is produced? This myelin is produced by oligodendrocyte cells. Now we will discuss about the overview of multiple sclerosis, how it happens. First of all, the demyelination of axon occurs. Secondly, our immune system inappropriately attack this myelin. Then these myelins are damaged. In the region of damage of the myelins, the breakdown of the neurons and the communication between these neurons, which results in the sensory and motor problems. Now we will discuss about the pathophysiology of multiple sclerosis. As we know, it is autoimmune disease. So our antibodies and the T cells attack on the myelin dendrocyte glycoprotein and the myelin basic protein, which leads to the loss of myelin sheath and the no cell tree contraction. The chronic inflammation leads to the demyelination. In this inflammation, the main cytokine involved is the interferon beta, and it causes are the scarring, second degree axonal injury. Also, in the later stage, there can be cerebral atrophy. Now we will discuss about the classification of the multiple sclerosis. It is divided into 4 types: the benign, the relapsing remitting type, the secondary chronic progressive type, and the primary progressive type. Let's talk about the risk factors of multiple sclerosis. First of all, females are more affecting than males. Secondly, the people who have vitamin D deficiency are likely to suffer multiple sclerosis. And thirdly, a person who had herpes simplex infection before are most likely to have this multiple sclerosis. Now we will discuss the clinical presentation of the multiple sclerosis. First of all, the affected organ should be brain or spinal cord. Along with that, eye, especially the optic neuritis because of the demyelination of the optic nerve. And the most commonly, patient will present the sensory presentation like paresthesia, hyperesthesia, and the tingling. And the motor symptoms are like exercise-induced fatigue, and the automatic nervous system symptoms are the bowel and bladder dysfunctions. Positive symptoms for the multiple sclerosis. First of all, Tophes phenomena. It is the abnormal heat sensitivity. It is the feeling of abnormal heat sensitivity, and the second is the visual blurring during the hot shower. Lermathes sign. In the Lermathes sign, we can see when the flexion of neck, we can feel an electric shock like current. For the diagnosis of multiple sclerosis, we done 2 important investigation. First is MRI. In the MRI, T2 flare MRI, in which we look for the hyperintensities in the central nervous system. For example, the most common area is preventricular, and the second most common is juxtacorticular, and the third most is the spinal cord. We look for the hyperintensities. The second way of investigation is spinal tap. We collect the cerebrospinal fluid, and we look this cerebrospinal fluid, in which we found high level of protein. So we can find the oligocolonal bonds there. The treatment of multiple sclerosis is vary from person to person. However, for the acute attacks, we can use IV methyl prednisolone 100,000 mg for 5 days. For the prevention of this multiple sclerosis, we can use interferon beta, glutamate acetate. Thank you for watching.